Hospitals and doctors' offices are resuming non-essential care, but some families may have concerns about COVID-19. Spectrum Health wants patients to know they are taking extra precautions and have options for you. Annie Satosky breaks it down in this week's Medical Moment.
Whether a patient is a child or an adult, doctors say the safety measures we started at the beginning of the pandemic remain the same.
Frequent hand washing, and with kids that's 20 seconds minimum. And personally, I feel as though soap is a better alternative to hand disinfectant or sanitizer. The more people wear masks, the more protected we are of spreading this virus.
Dr. Kimberly Mitchum with Spectrum Health Medical Group Hudsonville says they've upped their protocols for office visits, including temperature checks, no waiting rooms, and new scheduling.
High fevers or questionable symptoms, we're trying to schedule those patients at the end of the day to limit their exposure and the office setting.
And of course, more cleaning.
We typically are sanitizing the equipment as soon as patients are evaluated. Myself, I clean my stethoscope before every patient encounter.
If parents still aren't comfortable bringing kids into an office, there are virtual options.
Ironically, although COVID does not spare younger patients, ironically, in the world of infectious disease, it seems to give a break to the younger patients as compared to the 60, 70, 80-year-old patients.
Dr. Mitchum says the one thing you don't want to do, though, is delay care, especially when it comes to vaccines.
The longer we delay a vaccine, the longer it takes me to protect a child. And if a child is exposed to an infectious agent, we have that much longer or that much higher risk of them acquiring that illness.
She says parents can check out cdc.gov, aap.org, or call their primary care doctor if they're unsure about their vaccine schedule. If you're wondering about school in the fall, Dr. Mitchum encourages families to look at their family tree. And if direct caretakers are at high risk for COVID-19, it may be best to do remote learning. No matter what, though, she says keeping your children healthy will boost their immune system.
If you're helping a child from a diet standpoint and a sleep standpoint, you're giving them a foot ahead. Then you practice the mask and the hand washing.
She says it's important to keep lines of communication open when talking about the virus and to educate kids about how germs spread.
One of the things that have helped kids learn sometimes is experiments at home where they're putting their hands in glitter, going and washing, coming back and seeing how much glitter is still on their hands, and then saying, listen, imagine if that was a germ. You still got this many germs on your hands.
And for more information, you can call 616-669-9238 or visit spectrumhealth.org/ready for you.